Do you ever have discussions with physical therapists or even chiropractors, other health practitioners that really, jumping back to our previous statement, that they are aligning joints, they are moving ligaments and tissues to increase mobility? And how do you get your point across to them and getting them to think a little bit differently if you really are kind of at the debate podium trying to change people's mind? What's the one thing you want people to think about?
These are a really good question. I mean, and it just depends on what audience I'm speaking to. Because, right, I work in an office with many doctors of physical therapy, and, you know, our type of treatment is going to be different than maybe a chiropractic treatment. And I'm not trying to stereotype a profession, but it's really hard to explain these effects to patients who have already been to chiropractors for years, who have been heavily driven by a biomechanical explanation, because it's easy, right? If they have faulty positions of the spine, they're going to keep coming back for adjustments so that they could be aligned again. So when I'm having a conversation with a patient, it's a really slow drip type explanation to them. But if I'm having a conversation with another healthcare practitioner, like a physical therapist or physician or a chiropractor, I really ask them specific questions on how they believe something is working. Because this whole corrective theory, or this biomechanical theory, has really been perpetuated for a long time. And the evidence currently just doesn't show that it's reliable. So we can't be just driven in evidence. That's kind of what drives medicine, but we have to account for our experiences and our mentorship. So we have to really kind of slowly tease in the evidence-based practice behind how we're explaining our interventions. And I always come back to several different, there's a few research articles that I like to pinpoint in particular for those people who are just resistant to change, if you will. But we still see a lot patients being explained by different physical therapists that their joint is out of aligned or their rib is out. So when we impart a force back to the ribs, we're actually placing the rib back into place, or the SI joint comes out of place and we're using a muscle energy technique to put it back into place. So I really think that it takes some time to explain this type of intervention, especially to the providers who are actually doing manual therapy on a day-to-day basis. But it really doesn't take much beyond a few simple articles of reading to grasp the kind of neuroscience behind how manual therapy works from what we know today. Like I said before, we still don't exactly know how it works, but the research is gearing us down this pathway of these neurophysiological effects. And I think once you could get an understanding of that, it's an easy explanation to go on rather than perpetuate this biomechanical theory, which we're trying to move past as a profession.